Welcome back to the show where we're going to talk a little bit about a taboo subject today. And it's one of those subjects that's very important. And people probably wonder to themselves, how prevalent is it? Why do we have these discussions? Well, it's more prevalent than you probably imagine. I'm talking about irritable bowel syndrome. The month of April is IBS Awareness Month. And here to help bust some myths that surrounding IBS out there is Dr. Joyce Johnson joining me here on the show. How are you, Joyce?
I'm good. Thank you so much for having me.
It's a pleasure. And this is kind of a taboo subject. There's no doubt about it. IBS, Joyce, how would you describe it to our viewers?
Well, IBS, it stands for Irritable Bowel Syndrome. And the symptoms can really vary from person to person. So what it is like digestive disturbances that you might be having. Some people find it very isolating because no one is talking about their consistency of their poo, the frequency of their poop. Like, these are things that we don't always talk about. But some of the other symptoms can be, cramping, and they can have a lot of different causes. It could be due to dysbiosis, so like disharmony of the bacteria in your stomach. It can be due to stress, anxiety, food intolerances, so maybe eating some foods that irritate your stomach. So there's a lot of things that can play into irritable bowel syndrome, and there's not necessarily one thing that causes it.
Yeah, are there treatments, Joyce, available?
Well, there are. So there are some pharmaceutical options that people can try. So always speak with your healthcare provider and see if there's something that might work for you. There's also a lot of dietary things, natural options that you can do. So incorporating specific types of products that are specific for IBS, and also things to help alleviate stress and anxiety in your life. So some things that can provide an outlet if that is one of your triggers.
Right. Well, we're going to talk diet in just a few minutes, but let's talk first of all one of those myths, and that is that it's IBS is a rare condition, which brings us to that topic of prevalence, right?
Right. And that is definitely a myth. So it's more common than people think. According to the Canadian Digestive Health Foundation, Canada has one of the highest prevalences of IBS in the world.
Wow.
Not a great stat that we want to have. So what they say is it's estimated about 18% of our population suffer from IBS. And 70% of those people say that their symptoms affect their daily lives. And the majority of people with IBS are women.
Right. So the other myth we wanted to talk about is that the IBS symptoms are the same for everyone. You talked about symptoms off the top, but that's not the case. I mean, there's a number of different symptoms out there.
Yeah, absolutely. So they're not the same. It's a group of symptoms that can vary from person to person. People with IBS typically have stomach pain and digestive and bowel changes. So some lean more heavily onto the constipation side, some people on the diarrhea side, and some people flip back and forth between the two. And then you can have some other symptoms like a feeling of fullness. You could have increased belching, increased gas. You can have heartburn. You can have acid reflux, nausea, and even difficulty swallowing can be a symptom of IBS.
Another myth we wanted to tackle today is that diet, a specific diet perhaps for IBS can actually cure it. That's a myth in itself as well, right?
Yes, absolutely. So there's no cure for IBS, but for some people, certain diets can help with symptoms. So one of them is what we call the low FODMAP diet, which restricts certain groups of carbohydrates. So FODMAPs is an acronym. It stands for these really small carbohydrates that your body has difficulty digesting. So they pass through your stomach into your small intestine, and the bacteria then will ferment them. And that will cause the increased gas and bloating and sort of IBS cascade that follows. So this has been well researched at Monash University, and they developed the low FODMAP diet. And it's essentially lists of foods that are low FODMAP or high FODMAP.
Okay.
And the high FODMAP foods are not like just all of your terrible, poor choice foods.
Right.
They just happen to be foods that are higher in these sugars. So here I have low FODMAP. I have some quinoa. So I have brie, And oftentimes, dairy falls on the high FODMAP side, but brie falls on the low. I have broccoli, I have some berries, oatmeal, lentils, bananas, eggs, almond milk, as opposed to dairy, just because that falls on the high FODMAP. And then this is an example. So I have maple syrup here.
Okay.
That's low FODMAP, but honey is high FODMAP.
Interesting.
So if you're someone that might add something into your tea, just look at those lists. You can Google them and you will find, or on Instagram, you'll find so many lists of low versus high FODMAP choices. And the other thing with your diet is that you want to incorporate fiber.
Right.
And this can often be a problem for people with IBS because not all fibers are created equal. So you want to look for a low FODMAP fiber that is specific for IBS, and then it shouldn't make your symptoms worse. So that's important.
Our last myth we wanted to tackle today is that IBS is all in your head. And I am sure many people that live with IBS have heard that, even perhaps from their doctor. That in itself is a myth as well.
Right. So, well, it is a chronic gut-brain disorder. It's not something you're making up. Psychological factors like stress and anxiety can certainly trigger IBS, but IBS is not a psychological disorder, but it is a disorder of sort of your gut and your digestive system and that dysbiosis. So having that too much of the bad bacteria versus good bacteria can play a really big role in IBS and how your symptoms are presenting. So you want to incorporate good bacteria, probiotics, probiotic foods. I have some sauerkraut, pickles. I have some red beets. So think about fermented foods also that are low FODMAP.
Right.
Or incorporating probiotics into your diet because you want to repopulate your gut with that good bacteria to help balance off all of those bad things that are happening and the gas and the indigestion that's coming from having that disbalance.
Right. Joyce, great advice as usual. Really appreciate the time. Don't go away. We're talking to the Ottawa Little Theatre coming right up.